We're going to hear from my colleague, Dr. Jeff Barke, remotely. He is a primary care physician in, I believe, Orange County region, and he also has extensive experience with the school situation. So we look forward to hearing what he has to say.
I'm going to go ahead and get started, and I thank you so much for allowing me to be part of this, especially remotely. I'm a board-certified primary care doctor. I practice in Orange County, California. I'm also the co-founder of a local charter school and the board chair of this charter school called Orange County Classical Academy. And up until very recently, we were scheduled to open live in person on August 13th. And the reason why we were going to open live in person is because I have been studying COVID-19 for many, many months. I treat COVID-19 patients in my office and have done so for many months now. And in Orange County and in all of California, as you have heard, there's been 0 COVID deaths throughout and 0 in Orange County. And what we're learning about this virus is that children are relatively immune to it. When they do catch this virus, they do phenomenally well. They either have no symptoms or they have mild symptoms. And what we're also learning is children do not spread this virus to adults. So it's important to note that despite what our governor here in California has put forward, we have a mechanism to safely open schools with almost no risk to children and certainly very little risk to their adult teachers. And the reason why we know this to be the case is when you look at schools that have been opening throughout the world, 22 countries in Europe, Germany, Finland, Sweden, etc.
I have no idea how to make that
As
go.
Dr. Hamilton had mentioned, there is not a single documented case anywhere in the world of a child passing this virus on to an adult. Even if that could happen, we have to remember that what a healthy society does is we protect the most vulnerable. And as we know from this virus now and studying it for the last several months, the most vulnerable are those older folks that have pre-existing conditions. We know that about 50% of deaths in the United States has occurred in nursing homes. And for the younger age group, we are very effective at treating this, and the risk in the younger age group and the healthy is very low. It's no more deadly and no more contagious than a seasonal influenza. And we never close the schools down in seasonal influenza. And if you look at the risk of a child or even a younger adult to this virus, you will see that there are far more risky activities that we participate in. Much greater risk of drowning in the summer than they do of dying from COVID-19. A child has a much greater risk of dying in an automobile accident on the way to school than they do from COVID-19. And we're hurting our children right now by keeping our schools closed. Many of the children in California get their meals as a result of school. There's a measure of kids that are qualifying for free and reduced lunch in school, and in some school districts that's as high as 50%. And what that means is in some school districts, 50% of the kids rely on the schools to feed them. We also know that closing the schools disproportionately hurts those in the lower socioeconomic class. And as a result of that, we have learning loss that occurs naturally every summer. And then when you keep the schools closed, that learning loss even accelerates. And that is most severe in the lower socioeconomic class. And so in effect, the closing of the schools unnecessarily, the closing of the schools despite the science, is a form of racism. No, really. The Black and brown community is disproportionately being harmed by those that say they want to help this community the most. And we have the mechanism to help, and that is through our schooling system. My charter school, for example, we have 360 children. Our school is full. We have a waiting list of over 250 kids, and we're ready to open and to open safely. There are some common sense activities that we can do in the schools to keep both the kids and the adults safe, and we were planning to do this. And that is some of the things that you're used to seeing now when you go into retail establishments. We do a temperature check, a non-touch temperature check of their forehead. We insist that anybody that isn't feeling well, that's sick, that has a temperature, that they not be allowed to come into school and stay off campus. The same thing with teachers and staff and parent volunteers that are going to be in the classroom. We have a plan to sanitize the school regularly to make sure that it stays clean. We have a plan to use hand sanitizer multiple times a day for the children and good hygiene. So we have mechanisms in place to do what we can do to keep the kids safe and to keep the adults safe. And by the way, if there is an at-risk adult in our school, we can keep that at-risk adult safe without requiring draconian measures on all the children that scientifically just are not correct. We know that masking of children is an unhealthy, unnecessary, not based on science activity that really serves no purpose other than to create more problems than it solves. To the extent that a teacher or even a parent is worried about this virus and they want to participate in an activity to help keep their kids safe, we're fine with that, and schools should be fine with that. You know, if you think about California, and this is happening all over the nation, California has over 1,000 independent public school districts. Each of those school districts have elected boards of education. And if you've ever been to California, it's quite a diverse state, from very rural areas to urban areas to the mountains, to the sea, et cetera. And to impose a one-size-fits-all strategy on our school districts is just not correct. It's not right, and the parents don't want it. One of the largest school districts in Orange County is Tustin Unified. They did a survey of the parents to see which of the parents would be willing to send their kids back to in-person learning. And that survey was approximately 80% of the parents were willing to have their kids back in the schools physically and not do a remote learning. And this type of surveying is happening all over Orange County, and the results are very similar. The vast majority of parents want their kids back in the schools. We forget that keeping the kids home is not just about keeping the kids safe. It's about control, and it's also about hurting the economy. It hurts the economy most in working class parents, socioeconomically disadvantaged parents that don't have the luxury of being able to pay for daycare so they can go to work, don't have the luxury of being able to hire a tutor or create these micro school systems where groups of parents join together and hire a teacher and create daycare scenarios so the parents can go to work. That's happening even in our school. So we've announced now that we have to open via distance learning. And the reason why we do that is our funding comes from the state. So if we go against the state mandate, then we won't get the funding to be able to operate our schools. Private schools, because they get funding directly from the parents, are more likely to disobey the governor's orders than public schools. But we're required to follow the orders or not get funding. But even within our schools, even within our school, we have parents now that are going to be hiring teachers, that are going to be hiring tutors because they can afford to do so to maintain their children's education. And many of our parents are not able to do that. They can't afford to do that. We'll do the best we can with distance learning. There's no question about it. But distance learning is a far, far worse substitute than in-person learning. Even the teachers' unions, UTLA, that's the second largest teachers' union in the entire country, acknowledged themselves that distance and remote learning via Zoom, via computer systems, et cetera, just does not work. It fails, and it fails disproportionately in the socioeconomically disadvantaged households, and that's just not tell you and to advocate on behalf of parents and behalf of children. It's critical that parents push back. The only way we're going to be able to make a difference is for the individual parents to push back and to tell their governors and to tell their local legislators that they've had enough, that they want their children in school, and to allow physicians and healthcare workers to follow the science in keeping the schools safe, and we can certainly do that. We have models throughout California of how to do that. The County Board of Education here in Orange County, California, passed an extensive white paper guidelines on how to open schools. The guidelines are out there. The ideas are out there. We just need to allow individual school districts to make those decisions, what's best for their community, based on guidelines, based on what the parents want, and most importantly, based on what the children themselves want as well. My wife and I were up in Sacramento, that's the capital of California, this past weekend. There was over 1,000 parents and their children that showed up on the Capitol steps to ask and demand the governor to allow local control over these decisions and not mandated control from a top-down bureaucracy. And I think that's important. I think that's what we're all about here in America, is local control and independence, and not a top-down approach from at least in California, from our empirical governor. So as a primary care physician who has treated numbers of COVID patients, as a matter of fact, the reason why I'm not with you in Washington, D.C. today, and I would love to have been, is because I have patients that I need to care for. As a matter of fact, I got a phone call from 2 new patients that found me that recently tested positive for COVID-19. So I'll be in the office today communicating with them and putting them on a protocol to keep them safe. The other good news is we talk about the risk to students, the risk to parents, the risk to teachers, et cetera, is that when treatment is instituted early with mild symptoms, we're really good at treating this disease. We get into trouble when we wait too long and we wait for patients to be critically ill and to be well on their way in the course of this illness. When we treat this illness early with mild symptoms, and you'll hear more about this later, we are fantastic at treating this. We're getting better than ever. Hospitalization stays are shorter. I have a patient that just went home yesterday from about a week-long hospitalization. As a result of the treatment, he was able to recover. He never required ICU care, and because of early intervention, he's doing just fine. There's a local children's hospital called CHOC, Children's Hospital of Orange County, where they've treated a number of children that have had COVID-19, and universally they do well. Rarely do they need to be hospitalized. And when they do need to be hospitalized, the hospitalization is for a very brief period, mainly for fluids, et cetera, and then they're sent home. So children are relatively immune to this illness. Not one child has died in all of California due to COVID-19. There is no evidence that children are passing this virus on to adults, and we have plans to open the schools safely. Parents want the schools to be open. Their health and well-being of children depend on our schools being open. And it's important that we allow our schools to open safely, effectively, so our children can begin again their education that is so important for their well-being and for their mental health. I'll leave that here, and I'm happy to answer any questions, and I'll turn this back over to Dr. Gold, and I appreciate the opportunity to be with you for a few minutes this morning.
Thank you so much, Dr. Barke. So I hope all of our viewers are getting a lot of information and will be advocating for their families and their communities and do what's best for the children. We're hearing over and over that from a medical perspective, don't worry about your children. Send them to school as long as the schools can be open.